Our first section in lifespan development is going to deal with infants and or newborns. Safe to say that this doesn't make up a large demographic of the patients that we work with. And in fact, it's such a small demographic of those patients that we're actually not very proficient at dealing with neonates or newborns or infants. The National Registry is aware of this, and so they try and place more of a focus on these kinds of age groups and demographics to try and help overcome that. So pay attention in this particular section and try and take in as much information as you can so it will help you later on when you are faced with these patients.
An infant is age 1 month to 1 year, and they develop at a startling rate. Neonates, birth to 1 month, will cover specifically in Chapter 31, Obstetrics and Neonatal Care. Some of the physical changes that we see with infants are their vital signs. We have to understand that the younger the person, the faster the heart rate and respirations. At birth, a heart rate of 90 to 180 and a respiratory rate of 30 to 60 are considered normal. Shortly after birth, the pulse often drops to 100 to 160 and the respiratory rate drops between 25 and 50. By 1 year, the rate slows to 20 to 30 breaths a minute for respiration. Blood pressure directly corresponds to a patient's weight, so it typically increases with age. The average systolic pressure is between 50 and 70 for a neonate and 70 to 95 by age 1. A neonate usually weighs 6 to 8 pounds, or 3 to 3.5 kilograms at birth. They grow about an average of 30 grams a day, and the head accounts for 25% of its body weight. By the end of the first year, the weight will actually triple. At 4 to 6 months, it will probably have doubled. The cardiovascular system, at birth, a neonate makes the transition from fetal to independent circulation. The pulmonary system in infants younger than 6 months are prone to nasal congestion. Their rib cage is less rigid and they can more easily occlude their airway. The reason for this is their proportionally large size of the tongue and a proportionally shorter, narrower airway. If we're utilizing bag mask ventilation, we have to remember that an infant's lungs are fragile. If we ventilate too forcefully, it can result in trauma from pressure or barotrauma. Respiratory problems are quickly to become life-threatening. Infants who are struggling to breathe can quickly tire, become overheated, and even dehydrated. An infant's nervous system's evolution continues after birth. Neonates are born with certain reflexes. The Moro or startle reflex happens when a neonate is caught off guard. The neonate opens the arms wide, spreads the fingers, and seems to grab at things. The palmar grasp occurs when an object is placed into their palm. The rooting reflex takes place when something touches the neonate's cheek. The neonate will instinctively turn his or her head toward the touch. The sucking reflex occurs when a neonate's lips are stroked. This and the rooting reflex are often tested when feeding. A neonate's fontanelles allow the head to be molded through the birth canal. The 3 or 4 bones of the skull eventually bind together and form suture joints. Generally, the posterior fontanelle will fuse at about 3 months, and the anterior fontanelle, which is on the top of the head, usually fuses between 9 and 18 months of age. Their immune system maintains some of the mother's immunities, and infants can also receive antibodies via breastfeeding, which further bolsters their immune system. Here you see examples of the fontanelles. This is the anterior fontanelle, and it allows the skull plates to overlap during the travel through the birth canal. The posterior fontanelle is smaller, closes more quickly. Psychosocial changes begin at birth for neonates. They evolve as the infant interacts with and reacts to the environment. Crying is the main method of communicating distress. The key to having a happy, healthy infant is spending time with the child. Bonding, or the formation of a close personal relationship, is based on a secure attachment. A secure attachment occurs when an infant understands that parents or caregivers will be responsive to their needs, and a child can reach out and explore knowing that the parents will provide a safety net for them. Another type of attachment, anxious avoidant attachment, is found in infants who are repeatedly rejected. Children show little emotional response to their parents or caregivers and treat them as they would strangers. Separation anxiety is common in older infants. and the normal reaction peaks between 10 and 18 months. It involves clingy behavior and fear of unfamiliar places and people. Trust and mistrust refers to the stage of development from birth to about 18 months, which involves an infant's needs being met by his or her parents and caregivers. When caregivers and parents provide an organized, routine environment, the infant gains trust in those individuals. If the environment is not perceived as secure by the infant, a sense of mistrust will develop.